Hey guys, welcome back to NFlex. My name's Alan, and today our video is going to be a mock interview for a med-surg position. So get comfortable, grab all of your materials, and let's sit down and have a discussion. I think this video is going to be a great way to experientially prepare for an interview, especially if it's your first one. Kind of know what you're getting yourself into, what to expect, and the kinds of questions that you will be asked. So let's get started. Hello, welcome to your interview. How are you doing today? Good. Okay, so we're going to get started. My name's Alan. I'm going to be interviewing you. I'm the manager of this unit in this facility. So tell me a little bit about yourself, your pastimes, your experiences, anything you'd like. Okay, very good. And because you're a new graduate, I want to know a little bit more about your qualifications. So tell me about any awards, certificates, any outstanding moments that you remember from your education, from school, and let me know a little bit more about them. Okay, very good. So you've had a couple of placements in school in this hospital. That's really great to hear already. So now we're going to get into some clinical questions, if that's okay. The first one is going to be about the Braden scale. So let me know off the top of your head the risk factors of developing a bed sore or pressure ulcer, and also let me know why the Braden scale and Braden assessments are so important. Very good. And you're completely right about that last part. The reason they're so important is because pressure ulcers are something that are completely preventable, 100%. So it's good that you know all of those risk factors. So the next question is a bit of a case study. So you walk in, your patient has a history of diabetes mellitus. You walk into the room and you find them unresponsive. What is the first thing that you do? How do you handle this situation? Mm-hmm. Okay. And what do you do if they have IV access? Okay, very good. And what if they don't have an IV? Mm-hmm. Okay, so let's rewind a little bit. You walk into the same patient's room. We're going back in time. So you walk into the same patient's room, you assess them, and instead of finding that they have their vital signs are stable and they're just hypoglycemic, you find that they actually don't have a pulse. How do you handle that situation? Very good. Okay. So you walk into a patient's room at the beginning of the day and you know that they have a history of COPD. They recently had an exacerbation. They were treated with antibiotics for pneumonia. They've recently been discontinued because their pneumonia has resolved. However, they are now developing a fever. How would you perform a focused respiratory assessment? Let me know which systems you would assess. Mm-hmm. Okay. Is there any other system you think you might want to check out for a respiratory? Remember, we're doing a focused assessment, so just let me know which systems you think would be associated with that. No? Okay, that's fine. We can move on. We can come back to it after if you'd like. One more case study, one more clinical question. You walk into your patient's room and you realize that they have fallen and it was an unwitnessed fall. Let me know what you would do, how you would assess them, and how you would handle the situation. Okay. And would you get them back up to bed before or after doing a neurological assessment on them? Yes. You definitely want to do the neurological exam before you get them back up to bed to make sure that they haven't suffered some sort of spinal injury, head injury, anything like that. So, very good. So tell me about a time that you experienced conflict in the workplace and how you resolved that. Let me know a little bit more about the situation, who you were in the situation, who the other people were, and how it was taken care of. Okay. Now tell me a little bit on the other opposite end. Tell me about a good situation. Tell me about a situation where you went above and beyond, where you really got a good sense of, you got a good recognition from the patient, from their family, from your team, from your colleagues. Tell me about that situation. Mm-hmm. Mm-hmm. That's very good. That's very sweet and heartwarming that you went above and beyond for them like that. Very nice to hear. So, last question. I just want to know why you're interested in working for this facility, this unit in particular. Let me know more about your experience with our facility. I know you mentioned earlier that you did a few placements here, but tell me more about that. Mm-hmm. Yeah, definitely. The unit culture here is wonderful, and I'm glad that you were able to experience that. And it sounds like you really do have a good experience and a good understanding of the kind of population that we work with here. So very good. That's actually all the questions that I have for you. I want to know, do you have any questions for us? So very good question. We have a bunch of learning opportunities here within the hospital and a lot of opportunity for growth. For example, within this position, we also have a sponsorship program where we actually sponsor you to go back to school if you need to get any kind of cardiac, advanced cardiac care, critical care, and then you can also transition into a critical care role if you are selected to do that program, which is very nice. So we have lots of opportunities opening up, especially in the near future. Okay, so a typical day on our unit, we usually have about 7 to 8 nurses. Our patient load typically is about 4 patients per nurse for the day, and at night shifts it can go up to around 6 patients. The day, it pretty much rolls the same way as any other med-surg day will go. It's pretty standard. During the day, you perform all of your morning care, and then your patients will frequently go and see the physiotherapists, occupational therapists. They'll meet with social workers, meet with the surgeons and doctors. Most of the time they'll be resting, recovering from their surgeries. And yeah, during the nighttime it's kind of the same minus all of the interprofessional care. It's more on the nurses, just to make sure everyone's comfortable because they're in an unfamiliar environment. And we get it, it's difficult to sleep, especially with all the noises and stuff happening. So yeah, very good questions. So that's pretty much it. If you don't have any more questions, then we're all done here. I want to thank you so much for coming in, and we'll be in touch probably around next week. Okay, thank you very much. All right, guys, so that's it for the interview. So now we're going to go over what are the proper things to say and respond to these interview questions. So the first question was, welcome, how are you? You answer, how are you? I usually go in with a positive attitude. I don't want to come in and they ask me how am I and say,
oh my God. The bus was late, and I almost didn't make it, and oh my God, I slipped on some ice coming in. It was a dread.
Immediately they're gonna be like, So while there is no right answer, there is a right mindset that you can go into the interview with that will prepare you for success more than the other. Tell me a little bit more about yourself. They're not asking about your favorite color. They're not asking about the name of your cat. They're asking specifically about and how you fit into this position. Whether that is telling them about your education, whether that is telling them about any recent certificates or awards that you've received, any experience in the hospital, any volunteering, everything that is clinically related to why you are in that room right now. That also goes into what are your qualifications. This particular interview was set to be kind of a new graduate interview. When they ask you about your qualifications, again, this is, I had this GPA, I'm really proud of this thing that I did in school, I did really well with this, I work particularly well with this population that is in this unit, I have experience with this hospital, with the population, with the unit culture, I've worked here before and I really enjoyed it, those kinds of things. So when we started getting into the clinical questions, one of the first questions I asked was the Braden scale, and I asked you to note as many risk factors as you can remember off the top of your head. So some of the risk factors include skin pressure, skin shearing and friction, which means that when you're moving the patient back and forth, there's friction and shearing being applied to the skin. Especially with older patients who have a loss of subcutaneous fat, the skin shearing and friction can pose a particularly high problem because of the loss of collagen, and their skin quite literally rips like paper. I've seen it and it just goes, and it's scary because the blood comes really quickly. Immobility is another huge risk factor, especially after surgery, especially in a chronic medical facility, a medicine unit. Immobility is a huge thing. Next one is malnutrition, incontinence is a huge thing, and decreased sensory perception. Those are all risk factors for developing a pressure ulcer. If you can name 3 to 4 of those, you're pretty good. So why is the Braden scale so important? It's extremely important because most, if not all, pressure ulcers and bed sores are preventable. They don't have to happen, and once they do happen, they're extremely difficult to treat and reverse. It's much easier to prevent them, and that's why the Braden scale is important. For the next question, we asked about your patient with a history of diabetes mellitus. You walk in and they're unresponsive. So this is quite usually a question of hypoglycemia. That's why the best thing that you can do in that moment is perform an assessment, check their vital signs. Do they have a pulse? How's their blood pressure? How's everything, so that you can assess what to do next? If the vital signs are okay and you find that when you measure their capillary blood glucose and you take their blood sugar and you find that it's like 3.1, 2.2, that's when you know exactly what you need to do. So do they have IV access? Absolutely, they probably will have IV access if you're on an inpatient unit. In that case, you start infusing D50. Get an order for D50, start infusing it. D50W will absorb readily and extremely quickly into the bloodstream and will quite quickly reverse the hypoglycemia. If they don't have an IV, that's when you can go for the glucagon injection. If the patient is unresponsive, you cannot give them anything by mouth because they will aspirate. If they're unresponsive, it has to be IV, it has to be subcutaneous or IM. You have to follow the nursing process. So API, you did your assessment, you find that their blood sugar is low. You plan, you intervene with the blood sugar, whether it's glucagon or D50, and then you have to evaluate. So you have to go back and reassess. Did their blood sugar go up? Reassess in 15 minutes, the blood sugar did not go up. Repeat these steps until they become responsive, until they regain their consciousness, at which point you can give them the diabetic snack, the simple sugar, the carbs, 15 grams of carbs and sugar, just to help maintain their glucose. Something that I like to say as well is I want to look into why this happened. Why did they experience a hypoglycemic reaction? Did they not eat? Were they not eating and no one noticed? Did they receive the wrong medication? Is it part of a disease process? I want to know why so that I can prevent it happening again in the future. The last part of that question was the same patient. Let's go back in time. You perform your assessment, you find their blood sugar is low, however, they don't have a pulse. What do? The simple answer to this question is you call a code, you begin compressions. That you can go on to expand if you want, but That's it. That's what you do. You begin compressions, you begin immediate first response, life-saving interventions, and you call a code so that people come and help you. The next question was, you're performing a focused respiratory assessment. Which systems would you assess? Obviously, the first one is respiratory assessment. How would you perform a respiratory assessment? You inspect, you palpate, you percuss if you want, and usually we don't, and you auscultate. Auscultating is a very powerful tool, especially for the respiratory system. You see if they are having any sort of crackles, if they are wheezing, what's going on. After that, you can assess the cardiovascular system as well, because the respiratory and cardiovascular system are heavily related. If they're not getting enough oxygen and they're satting low, they're also going to have issues with their perfusion. Their heart rate might be going up. Their blood pressure might be going up to try to increase the amount of oxygen that is reaching the tissues. The last one that I usually forget for this question is neurological. Almost always when you're performing a focused assessment, you're going to do a neurological exam along with it. When you're having any sort of issues with your oxygenation and perfusion, you're almost always going to have a pH imbalance that goes along with it. And some of the earliest signs of pH imbalance are anxiousness, nervousness, agitation, those kinds of things. So performing a neurological assessment is very important as well. So the last question I asked that was a case study, a clinical scenario, was the patient fall. It was an unwitnessed fall. You walk in, you see your patient on the ground. What do you do? The correct answer is more so the correct assessments, but also in what order you do them is very important. The correct order is to take vital signs, perform a level of consciousness and neurological assessment prior to getting the patient up and back to bed. I made the mistake in an interview one time of saying I would take their vital signs, get them back to bed, and perform a neurological assessment because I was nervous and I just spat out whatever came first to me. However, the order of occurrence in these answers is very important. Very likely they could have hit their head, and they could even have some sort of cervical fracture that you don't know about. And if you get them up, that's just going to really make things worse. If you exacerbate a cervical fracture, quite literally, you could kill somebody. So the next question is conflict. Tell me about a conflict you had. This is more so a question that I answer, always referencing the chain of command. Always speaking with the person who you have a conflict with directly first, in a respectful way, of course. That's the most important thing. Can you handle conflict with respect? Can you deal with things in a respectful way? If the conflict isn't resolved with that individual, then you can move up and talk to the charge nurse, you can talk to the MRN, you can talk to your manager. Like, don't immediately take your problems to a supervisor, a superior, a manager right away. The idea here is to see, are you able to try to resolve conflicts on your own? Because people don't always have time to do things for you, and that's the reality of not just nursing but life in general. A good situation when you went above and beyond for the family, that's up to you. 100% reflect on this before you go into an interview. Think about one time that you felt really proud of what you did. A family explicitly and verbally said thank you, you did great for blah blah blah, and why it was so important to them. If they ask you why this facility or this unit, have good things to say. Remain conscious of their mission statement, remain conscious of the company's values, and state those if you can. State how they align with your own values. And that's why you want to work here, because it's very important for you to go to work every day knowing that you're doing the right thing, knowing that your values align with your company's values, and basically saying that you are a good match with this company. The last question is also very important. When they ask you, do you have any questions for me? Don't say no.
I'm just happy to be here.
They're assessing to see if you have really looked into this position. They want to see if you are considering them as much as they are considering you. Ask them questions like, are there opportunities for professional development on this floor? Don't ask this question if you have done a placement here, because you should know this, but if this is a new placement or a new place for you, say, what does the typical day here look like? You can also ask the interviewers, what is your experience? What brought you to this unit? I want to know more about how you discovered your passion for this unit so that I can understand if I'm a good fit as well. And then if they say something that really resonates with you, tell them. tell them, I'm really glad that you said that, because that's kind of how I feel as well. And it just reassures me that this is a unit that I see myself on, and that I can see there's a lot of room for growth for me here, and I would love to be a part of it. There's nothing wrong with saying something like that, like saying, I see myself here, it's a fantastic unit. It just shows that you're committed and passionate about the position, and there's absolutely nothing wrong with that. Those are very good qualities. Finally, it's kind of standard to thank the managers for their time. There is so much going on the unit, and just the fact that they put aside 20 to 30 minutes to sit down and speak with you, a complete stranger, 100% you should thank them for their time. I also like to say that while I'm always looking to learn and grow and challenge myself, and to grow as a practitioner and as a person, and the nurse that I am today is not the nurse that I'm going to be in the future. And I know that if I'm chosen for this position, that I will take all the opportunities I can to grow and learn and be a great addition to this unit. So this interview was kind of like a good interview simulation where all the answers were partially or mostly correct. The interviewer was friendly and courteous. That might not always happen. I hope that it doesn't happen to any of you, but if it does, just remember that it's a one-off experience. You still have the strength, integrity, and resolve to get through that and go on and move on to the next interview and absolutely smash it. So all the best to everyone out there. Good luck, and remember to like and subscribe and leave a comment if you found something helpful, or if you have an idea for the next video, and we'll see you there. Thank you so much.